Okay, today we are making the control visit of the same patient after 2 months of the operation. And when I do Doppler ultrasonography, I can see the testicular artery that we see in the operation and preserve this artery. And other than this, there is no residual veins. Normally in this place, if we ligate the veins that we took out, there will be swelling of the veins like a balloon. And they will disappear after 3 months, 4 months, 6 months, sometimes after 1 year, if they disappear. And 70% they disappear, but 30% they will not. But here, immediately after the operation, there is no big veins, and the only vasculature we see, as you see here, arteries. Of course, there may be some veins close to testicle, but most of the veins has gone. I am looking after the procedure very frequently with Doppler device to see what's happening, how is the recovery period, and we are closely following up these. And here I come near to testicle. There could be some residual veins here near to testicle. This is testis. But in this patient, as you see in the operation, we took out very large internal and external spermatic veins. Here is the little dead end residual vein, and let me measure it. Its diameter, let me freeze first. Okay, its diameter is less than 3 millimeters, maybe even smaller if I look at this part. And this is after 2 months after the operation, 2.5 millimeters. And these will also be disappear. I just leave a small part just close to the testis. I can't come and resect the veins here. It is dangerous. It can harm the artery, it can harm the spermatic channel. So very close to testicle, I leave behind some vasculature, and they disappear by themselves in a couple of months. Okay, here in this patient, I can see the artery pulsating. I can see the testis here. It is blood vessels, arteries are coming and feeding the testis nicely. Yes, here I can see the blood supply in the testicle without problems. And when I look here to wound, the scar tissue of the patient, and this is the scar tissue. It is like 2 centimeters. Sometimes it heals just like a line. Sometimes some keloid tissue may happen here. This is a moderate healing. There is a little line, not too much keloid, but it seems good. And healing is good. He also says after the procedure, the sexual activities changed a lot. He had better erections, better sexual desire, which is not a very common situation that we know in the literature. It's not told in our lectures, but we very frequently see from our patients after varicocele operation, if we take out the veins, sexual activities increase, improve too much. And he's very happy with this. After 2 months after the operation, he's very happy.